Hello, everyone, and welcome to our Friday edition of the CL Derm Staying Beautiful and Healthy webinar series. Today, we are here with Dr. Douglas Wu, and I see a lot of you joining right now, so I'm just going to give a couple minutes or a minute or two for you guys to get situated. But thank you so much for joining us on this Friday, gloomy, rainy Friday, but we hope that this is going to be informative. Dr. Wu has a fantastic presentation slated all about lunchtime lasers, which is definitely a great procedure that we offer and that I know a lot of you are interested in. We have received a couple questions ahead of time, but for those of you that that did not send anything, just so you know, you can submit questions while he is speaking. Down at the bottom of the screen, on your screen, there should be a couple little icons. One says chat and one says Q&A. The Q&A is where you should put any questions you have, and once Dr. Wu completes his presentation, we will start going through and try and answer all of them or as many as we can. The chat, if you have a question, specifically for me, or if you're having any troubleshooting issues or just a comment, you're welcome to put it in the chat. I will be here for you. My name is Risa. Okay, I think a lot of you have joined. So let me begin by introducing Dr. Wu. So Dr. Douglas Wu is a board-certified dermatologist. He has been with the practice for many, many years now, and even helped complete his fellowship training at with Dr. Goldman at the practice. So he has been trained by the best. He's also a PhD, MD, so he has the most titles and things after his name of any of our physicians. He's extremely qualified. He does injectables, body sculpting, veins, lasers, and all types of anti-aging treatments. But today he's going to be focusing mostly or all on lunchtime lasers. So we encourage you to start asking any questions that you may have so we can start slating them for the end of the presentation. And otherwise, I hope that this is educational and informative and helpful for each of you. Also, just remember that if you do have any personal questions and you don't want to ask them in this public forum, Dr. Wu is available for a virtual consultation, which you can sign up for on our website, and I'll say a little bit more at the end, but on our contact page, you can schedule something. You can also chat with me here. And he's also, on Instagram and social media, so he will give his handles at the end, and I encourage you to follow him because he is a great resource. So with that all said, Dr. Wu, it's all yours.
Thanks, Risa. Hey, guys. Thanks for watching in on this Friday morning, Friday afternoon. It is kind of gloomy in San Diego. But yeah, the topic of today is called lunchtime lasers. And what we mean by lunchtime lasers are essentially all of those types of laser procedures that essentially offer minimal downtime, but try to maximize effect. And so without further ado, let's kind of jump right into it. Now, the three major things that I want to kind of go through with in this presentation are a little bit on the science of skin laser. It's important to understand a little bit about this so that we know exactly what we're doing. And then what really can these lasers do? And finally, what are considered some of the best lunchtime lasers that are available today? And so what really is the science behind these skin lasers? It's actually really fascinating, and I'm going to try and sort of boil it down so it's not too boring or overwhelming. But when we look beneath the skin with these lasers, what the lasers are doing are targeting very specific molecules that are in the skin. And so our skin is basically made up of three basic layers. The most superficial layer is called the epidermis, the middle layer is called the dermis, and then the deepest layer is what we call the subcutaneous fat. And within the skin, there exist these molecules like pigment, okay, so melanin, that's what gives our skin color. There's blood vessels or blood cells, otherwise known as hemoglobin, and that's kind of in our blood vessels. And then finally, throughout the skin is a lot of water, okay? And these are the three main, you could say, targets of many of our lunchtime lasers. What the lasers do is that they target these specific molecules very, very specifically and deliver energy into them, and that energy basically transforms them and gives skin effects. There are thousands of different lasers out there, and they can reach all depths of the skin. And they are governed by three basic parameters: the energy of the laser, the wavelength of the laser, and the size of the laser beam. These are the three basic settings that we as laser dermatologists kind of adjust in order to achieve the goals that we want to achieve. Now, looking a little bit closer, pigment lasers, they strike at that melanin pigment and basically break it, okay? And when it gets broken into these small particles, it basically disappears and it becomes less visible. Similarly, with blood vessels, what we do is we take the laser and we hit those little blood vessels and cause them to shrink. And when they shrink, they essentially get absorbed by the body and again, diminish or disappear. In the case of water, we use a laser to hit at the water and it basically heats up that water, and that heat causes the new production of collagen and elastic fibers, all of these proteins that kind of make our skin supple and elastic and smooth and things like that. And so this is kind of the rejuvenation part of the lunchtime laser. So with that in mind, what really can these lasers do? Well, it turns out that lasers can do a lot. I'm going to focus mainly on the lunchtime lasers. And so I've selected a few things that I see very commonly in my practice that can be actually very, very easily and nicely addressed by these lasers. And so we'll start with brown spots, because brown spots I see a lot of, and there are many, many different types of brown spots. Basically, many lasers can treat brown spots if they're used correctly. My personal favorite is an advanced laser called the picoway. The picoway laser is what's called a picosecond laser, and it's one of the most advanced kind of lasers currently available for brown spot treatment. However, there are many, many other lasers that can do the trick, including the alexandrite, the IPL, the clear and brilliant, the fraxel, many, many more. At my practice, we have about 45 to 50 different types of lasers, and we use all of them, and many of them can actually treat pigment. And so what we find is actually combining multiple different laser modalities often yields the best results in the fewest number of treatments. So what happens with pigment, as I can sort of remind you, is that it gets kind of broken up by the laser. But clinically, what happens is that with freckling, they respond really quite well. This is pretty common. You get these frecklings kind of on the nose, and it's mild, right? And it may not bother many people, but some people are bothered by this. And so laser treatment, you can see, gets rid of it really nicely. This is also a very common presentation to the kind of the cheeks and around the nose bridge. And once again, you can see that after just one laser treatment, they're essentially completely gone. And the results tend to be really quite pleasing. Again, this is a little bit more extensive kind of freckling that involves most of the face, the upper face, the mid face, a little bit into the lower face as well, but with laser treatment, minimal downtime and maximum kind of results. This is probably one of the more extensive cases of freckling that we see, where it's basically freckles everywhere and they're kind of merging together into more of a kind of uniform brownish kind of color. And once again, with laser, we can really safely and effectively remove these. Skin of color is a situation that requires a little bit more caution and a little bit more attention to detail, just because this skin type is a little bit more sensitive to laser. But even with skin of color and in any ethnic skin tone, we can choose the right laser and we use it in the right way in order to achieve really nice results. Moving on from freckles, we have other brown spots and what we call sunspots. Okay, and these are what we call solar lentigines or seborrheic keratoses. They're essentially brown spots that develop in response to sunlight and genetics. And you can see they're different from freckles because they're kind of larger. They're a little bit more indistinct in terms of their shape, and they come in different shapes and sizes. And some of them even are a little bit pinpoint and elevated. And in this kind of situation, laser can also be very, very effective. As you can see in this picture here, with this patient, most of her sunspots have been completely resolved after one laser treatment. In this situation here, again, this is a very, very common situation that I face. This is a Vietnamese lady who presents with these sunspots on her cheeks, had them for many, many years, and she came to me really worried, that the cosmetic appearance was not what she wanted. And so after a couple laser treatments, they were mostly resolved. And then again, this was a Filipino lady who presented with a very similar problem. And again, in the darker skin tones, it becomes increasingly more tricky to treat. But again, selecting the right lasers and using them the right way can give us some pretty nice results. This Hispanic lady had a combination of, these flatter, larger ones, and then these smaller, more raised ones kind of to the side here. But once again, with the appropriate laser treatment, you can see how they resolve really quite nicely. And the downtime tends to be very, very minimal after this kind of treatment. This was an older Caucasian man who had these thicker, maybe a little bit harder to see in the photo, but they're really quite thick and raised. They're what we call the seborrheic keratoses. And these ones have to be treated a little bit more with different sort of laser modalities in order to get the best result. But once again, you can see after treatment, this one did take, I think, maybe 2 treatments, but they're almost entirely resolved. And he was really quite happy with that. The other thing that we treat is birthmarks. Sometimes you're born with these little sort of brownish kind of marks on your skin, and laser tends to be actually very effective for many of these types of birthmarks. And this is what we call a cafe au lait macule, and there's even a little mole kind of stuck in the middle there, but laser can really help resolve that. Similarly with this Malaysian fellow, we treated his cafe au lait macule with laser, and as you can see, it's almost completely resolved. There was a little bit of acne scarring with him too that I treated with laser, and that improved a bit as well. This is another cafe au lait macule here. A little bit close to the eye, so we had to be a little bit more cautious with the types of lasers that we did. But once again, you can see that it's mostly resolved after a few treatments. So really quite effective and minimal downtime lasers can achieve some really nice and pleasing results. More complicated cases often present to my practice. And our clinic essentially deals with almost every type of pigmentation, from the very simple cases to the very complicated. And so when I describe complex cases, what I mean are they're either combination problems. So they've got freckles, SKs, sunspots, and all sorts of different types of things going on. And on top of that, they may even have a little bit of what we call melasma, which is a hormonal form of pigmentation that is very sensitive to sunlight and can actually get worse with laser treatment if you're not very careful. And so in this situation, this Chinese lady here presented with this combination, complicated sort of picture, and it was very important to kind of identify, there's a little sunspot there, some little freckles kind of spotting around here and there. The melasma you can see is this patchy kind of pigmentation all over the cheek area. And then finally, even within the melasma, there's these discrete little spots. And so this was not necessarily a very easy case to treat, but again, with the theory of combining lasers in the right way and with the right techniques, you can see how after a couple treatments, there's significant improvement. It's not perfect, of course, there's still some residual, but she was very happy with this type of result. Similarly, in this Hispanic lady here, dominated mainly by this melasma patch. Okay, you can see kind of up into the forehead as well. But within this patch, there are all these little discrete pigmented spots as well. And, it's very tricky to isolate just those spots and target them when there's a background of melasma. But again, with the right combination of lasers, in this case, the peak away laser, you can really see that there's significant improvement. And this was just after 1 treatment. This was a Filipino woman, again, probably one of the most complicated kind of cases because she's got patchy sort of pigmentation that is diffusely involving almost her entire cheek area. But within that, there's really discrete and darker pigments. Some of them are elevated, some of them are rougher and raised. And so it's really, you have to really carefully plan and map out all of her treatment areas in order to apply the right lasers to the right times and places. But again, this was just 1 treatment, and she did rather well. So the next thing that lunchtime lasers can really treat well are these red problems. So red spots, broken blood vessels, anything that basically looks red on the skin, we probably have a laser for. And vascular lasers are probably the best option for this type of problem. And my personal favorite is what's called the V-beam laser. This is one of the industry standards. It's been around since about 1996, and it's gone through about 5 or 6 different generations of development. And at our practice, we have the latest 3 V-beams, actually, up to and including the so-called V-beam Prima. Very good laser for all sorts of red problems, but it's not the only laser that can be used. The intense pulsed light, or IPL, is very good for this kind of thing. Alexandrite laser can be used, Nd:YAG laser. There are many, many more that can actually treat a variety of different redness and vascular type problems. Again, combining the right laser in the right way at the right time is really the way to make it best. And so just to review, again, the laser hits that blood vessel and makes it small, and that reduces its appearance and makes it go away. And so for broken blood vessels, it can be really quite effective. This is one of the most common things that I see. It's these little blood vessels that are just kind of in the crease of the nose. And you can see after treatment, they're mainly gone. If you look really closely, you can see a shadow of them, but they're improved a lot. And this was between 1 to 3 treatment sessions. This was a little bit more extensive case of blood vessels to the cheek. But again, you can see it's very disfiguring, this patch here. And it extended throughout the entire face, to be honest. But with one treatment, we were able to achieve a very good improvement here. And then the second treatment gave even more improvement as well. Other red things that we treat are just general redness. You know, this lady had a red nose, and it was much redder than the rest of her skin, and so therefore it stood out, and she was quite displeased with that. But combining the V-beam with the IPL managed to really improve, you know, her redness for one. Okay, and that you can see kind of on the nose, but even her skin tone is significantly improved with this combination of laser treatments. This was a little bit more intense case, what we call rosacea, you know, it was really quite difficult to treat this one because with the redness, we were able to remove some of the redness here, but there was pigmentation underneath. And so the result was not perfect at the end of the day, but still there was significant improvement, and this patient ended up being really quite pleased with that. This is a very common issue that I faced, this combination of acne and rosacea and redness that really can be quite disfiguring and bothersome to people, even symptomatic. They get stinging and burning because of this redness. But with the V-beam laser, you can see really clear skin afterwards, nice even skin tone, and it tends to work really, really well. Finally, there's specific red spots. You know, I treat a lot of lip spots, and these are what we call venous lakes. They're collections of little blood vessels that pop up on the lip from time to time, and you know, can be sometimes concerning because you don't really know what they are, and so you think maybe there's a health problem, but of course they're completely benign. But also just because they don't look good, and laser is very, very effective. The V-beam laser in particular, even for larger sort of nodular ones, you can see that after one treatment, it's like virtually gone. And there's no trace of it at all anymore. And this is probably one of the most severe cases of one of these vascular sort of lesions on the lip. And you can see this took a combination of lasers and actually multiple treatment sessions. But at the end of the day, the lip is restored. She has beautiful lips, and it looks fantastic. There are these that are very, very common, what we call cherry angiomas, these tiny little red spots that pop up all over the skin. And they're due mainly to genetics, but sometimes other factors like pregnancies, et cetera, can kind of make them pop up a little bit. And you can see with laser, we just zap them, the V-beam zaps them, usually 1 or 2 treatments, and they're completely gone. Birthmarks. This is a common problem, what we call port wine stain. They're basically a benign collection of these tiny little blood vessels called capillaries, and you get them at birth. And what happens is that over time, as you get older, they actually start to get darker and larger and thicker. And so they become harder and harder to treat as you get older and older, to be honest. So it's important to actually capture these when you're young and treat them as early as possible. However, even if you wait until adulthood to treat them, they can still be effectively treated. This was again V-beam, combined it with some IPL, some other vascular lasers. And the key with port wine stains is patience and time. This is one particular treatment that does require multiple treatments in order to achieve the best results. And then there are a hodgepodge of other things, temple veins, you know, around the eyes. There's these purple veins that can cause the under eye area to look really quite shadowed. But if the laser can kind of reduce that, then the whole under eye area becomes rejuvenated. This kind of bulging temple vein here, it can be really quite displeasing to people, and it can get larger and bulge and pulsate and stuff. And so the laser can really remove that. Stretch marks, bruises even, acne, scars, anything that is red and has a vascular component to it can potentially be targeted by our vascular lasers and improved. So that's a lunchtime laser that really presents with almost no downtime, a little bit of redness, a little bit of swelling, but it can easily be tolerated in a busy life schedule. The final thing that we kind of treat with lunchtime lasers are skin tone and skin texture. Resurfacing lasers are the best for this type of problem. And resurfacing lasers are generally classified as either mild, medium, or strong. And they have correlating downtime, essentially the time it takes to recover and for the skin to look normal again. My good friend and colleague, Dr. Billy Groff, he did a fantastic webinar on the strong resurfacing lasers just last week, and encourage you guys to have a look at that one. For this lunchtime laser one, I'm gonna kind of focus on the mild to medium sort of class, because those ones have less downtime, but still can be really quite effective. These include things like the Peak Away, the Intense Pulse Light, the Clear and Brilliant, and many, many more. Once again, combining them into a unified, logical treatment plan really is the best way to go. And so just to review again, the laser targets the water in the skin. And this time when the water gets heated, it causes the stimulation of new collagen and elastic fiber growth that helps to even out skin tone and improve skin texture. And so here we have a Japanese lady who had roughened skin, uneven skin tone. There's this redness, this patchy sort of brown discoloration. Just overall is not quite uniform, okay? And her pore size is enlarged, and multiple problems are going on here. But with these sort of minimal downtime lasers, we can achieve results that are significant improvements over baseline. This young man here, he was an avid outdoorsman. He had a lot of outdoor hobbies, loved to surf, was out there every single day. And so he accumulated, because of his fair skin as well, significant amount of sun damage that presented as this reddish, brownish discoloration, roughened skin, enlarged pore size. And so this is how he sort of presented to me. And with the right combination of lasers, there was IPL involved, some V-beam, I had some peak away, clear and brilliant, et cetera. All these kind of lasers kind of combined into these treatment sessions. And within just actually a few sessions, we were able to get him to be into a much better place. African American skin is a particular skin type that suffers from uneven skin tone just because the baseline level of pigmentation is actually very high. And so variations in pigment can be really quite concerning. And so in this situation, it's not about lightening the skin. That's not really the goal. The goal is to even out the skin tone and make it more uniform. And so that's really our goal. And it's a subtle difference, but it's an important one. In this young man, you can see how some clear and brilliant lasers were able to do the trick. And this fellow here, also patchy, dark brown, light brown, sort of pigmentation, roughened skin texture. He even had like a scar up in his forehead there. And with some lunchtime lasers, we were able to even out that skin tone and give him a little bit of improvement. Skin texture is one of the hardest things to treat, honestly, and lunchtime lasers, they can go a certain distance, but sometimes if you really want to improve your skin texture to a great degree, then you got to go to a little bit of a stronger laser. However, in this situation, I'm going to explain a few things about skin texture that can be done with lunchtime lasers. For example, this young lady here had a little bit of roughness from previous acne and acne scarring, and with some what we call radiofrequency microneedling, we were able to achieve some very nice improvement. All of the individuals that I'm showing in my presentation, these are my patients that I've treated individually. And so I know their cases very, very well. This young man, a Vietnamese fellow who had, again, roughened skin texture from old acne and acne scarring with a combination of minimally invasive, low downtime lasers, we can see some really nice improvements in his before status compared to his after status here. This individual here had presented with some roughened skin texture, uneven skin tone. Melasma is also an issue for her, but after a series of treatments, you can really tell that the skin is smoother, the pore size has reduced, and overall the skin tone is fresher, it's more uniform, and she just looks more youthful and more vibrant. This was a Vietnamese lady, a combination, again, red, brown, some melasma, some uneven skin tone, some roughness, etc. All about the sort of the nose bridge, the cheeks. And this is a very, very common kind of presentation. I see this every single day in my practice. And again, with the right combination of lasers, we can achieve some really nice evening out of her skin tone and skin texture. So what can we say about lunchtime lasers? Well, our goal with lunchtime laser is to minimize downtime but maximize effect. Okay, and of course we have to be realistic. There is a certain sweet spot where we can't have too great of an effect because that will require a stronger laser, but the stronger laser has too much downtime. And so we really have to adjust our treatments and our recommendations on each individual case that comes in because everybody's skin's a little bit different. And so when we tailor these treatments to fit each individual person's needs and desires and wants, then that's how we can maximize our safety and our effectiveness. So my personal favorite lunchtime lasers to minimize downtime and maximize results are the Peak Away, the V-beam, the IPL, and the Clear and Brilliant. But like I said, there are a lot of other lasers that can do the tricks, and I use and have almost all of them. The key is to select the right laser for the right person at the right time and to use it correctly. Those are honestly the only principles that need to be applied. The actual specific laser device is not as important, to be honest. And once again, I know I've said this many times, but having that luxury of being able to combine multiple lasers, as well as the experience and expertise to do so, can really be a major advantage because it can sometimes yield really, really great results in a very few number of treatments. Well, thanks for watching, guys. Hopefully that wasn't too bad, and maybe you learned a little bit about some of the laser work that we do.
Thank you so much, Dr. Wu. That was fabulous. And I think people really enjoyed it because the questions are flooding in. So let's see, a lot of thank yous. And so for those of you that had some questions, I see Marty, one of them in the chat. If you guys could just move them all to the Q&A, that would be helpful. Otherwise, let's move to the Q&A portion of this session, and Dr. Wu is going to answer as many as he can. Oh, thank you guys for saying all the thank yous. I know, I agree, especially those graphics. And you guys know Dr. Wu actually even made those himself. He's so talented. He can't just be a great doctor. Okay, so let's start off. So Linda says, thank you, Dr. Wu. What is the best laser to use for hyperpigmentation and fine lines and wrinkles? IPL or PicoSure?
Hey, Linda. Good morning, or I'm not sure what time zone you're in, but maybe good afternoon. Thanks for the question, Linda. So there are many, many different lasers that can treat pigmentation and fine lines. And it really depends on the type of pigmentation, the degree of pigmentation, and the degree of fine lines or wrinkles that are present. And what I find is that the picosecond lasers can be really effective. And I currently use and own 3 of them, the Pico A, the PicoSure, and the Pico 4. And the advanced technology in these lasers allow them to operate by a very different sort of mechanism of action than traditional lasers that actually maximizes their effect, but also minimizes the downtime. Okay. Sometimes, though, you do need to rely on a little bit stronger lasers, such as Fraxel or even CO2 lasers, that can really resurface the skin for deeper lines and wrinkles and stuff like that. But those would be kind of my choices. IPL is a great one too for general kind of improvement of skin tone and reducing brown pigmentation. But for specific brown spots, the Pico Way laser, there's really nothing better than it.
Okay, great. Thank you. All right, here's a good one. Are there any lasers that reduce pore size or at least reduce the appearance of pores?
Hey, thanks for that question. You know, pore size is one of the hardest things that we have ever treated, to be honest, because they're very hard to measure for one. So it's hard to see improvement in pore size because they're so small. And number 2, you really have to generate a very strong collagen response with your laser in order to significantly improve pore size. So in the past, the only lasers that really could improve pore size were the strong ones. So things like CO2 lasers, erbium YAG lasers, and then strong Fraxel lasers. Those ones could really, sometimes improve pore size to a large extent. But, with lunchtime lasers, there's not many that can do it within a very small number of treatment sessions, but there is one and a class of lasers that is emerging as really a very good option for pore size, and I use it every single day. It's actually the Pico Way laser, in particular for patients with ethnic skin tones, because these stronger lasers, although they're effective, they're not really necessarily safe in darker skin tones, and so we can't use them all the time for pore size in those patient populations. But the Pico Way can actually be really good for pore size, even in darker skin tones. And so that's one of the lasers that I tend to use for patients who require a little bit more care in terms of their skin.
Very interesting. All right, so this one's from Julian, and she says, I have many keloid and hypertrophic scarring from acne all over my chest and shoulders. Have you treated patients in this situation? It's hard to find much hope for this condition on the internet, as it seems to be very rare and difficult to treat. I want to find the most successful route with the best and most experienced doctor because it's ruining my life. Thank you.
Oh, Julian, I really feel for you. That's a really troublesome problem, and I completely understand where you're coming from. I do treat these. I treat these very commonly, actually, so-called hypertrophic or keloid scars from acne, most commonly involving the chest, often on the shoulders and back, sometimes even on the jawline and on the face. The reason why we get these scars is because when the skin responds to the inflammation from acne, it basically triggers a very powerful healing response that lays down new collagen and repairs the skin. But in some cases, it goes overboard, and that collagen becomes thicker and enlarged, and that causes a keloid or hypertrophic scar. I do treat these a lot, and the approach actually requires multiple different types of lasers that are used. Some that sort of modify the collagen and break it up, some that modify the discoloration because they're often red or brown discolored, and then injections that further break up scar tissue. When we combine these three treatment modalities together, we find that we get the best results actually. The only really thing, the major barrier to this type of treatment is that it does require multiple treatments. Scars, there's no way, unfortunately, to rush scars along. They have to be treated with patience and with deliberation. And so it's treatment over treatment and patience and progress that is consistent, but it does take time and patience in order to get the best results.
Okay, great. Here's another one about keloid scars. She says, "Is a keloid scar that is caused by a laser cannot be treated? Silicone treatment has helped once, but silicone removed and I can still feel the bump."
Yes, so essentially any keloids or hypertrophic scar can be potentially treated with a combination of laser and or injectable type treatments, even those that are induced by lasers.
Okay, great. All right, so let's see. Some of you are putting the questions in the chat. If you can, try and use the Q&A so I can try and stay organized and get as many as we can answered. There's a lot here. Okay, let's see, when do you see real results using the Pico laser? I've had 2 out of the 3 sessions, 6 weeks apart.
So the Pico laser, usually you see results in 1 to 3 treatment sessions. That's been my experience with the picosecond lasers. Now, the degree of result can sometimes be variable. It can be anywhere from phenomenal, even after 1, to modest after 1 treatment. And it also depends on the types of things that we're trying to treat and the way that the laser is used. But I tend to find, in my experience, between 1 to 3 treatment sessions, we should see a satisfying result. And if we're not, then it's an indication that maybe we should reevaluate and adjust the plan.
Okay, great. So Mary, first she says, excellent presentation.
Thanks, Mary.
And then she says, can a laser get rid of a 20-year-old scar? And if so, which one?
That's a very good question. Our current understanding of scars makes us believe that the younger scars are easier to treat. Okay, they respond better and their outcomes tend to be more positive. That being said, though, scars that are older than 5 years can still definitely be treated. And again, it depends on if they're discolored or if they're depressed or if they're elevated on the types of treatments that we use. But again, a combination of laser and injectable treatment is the way to improve almost all forms of scars, whether they are young or old. And so there definitely are strategies for almost every single scar out there.
Okay, great. So here is one from Marty. Do you prefer lasers over chemical peels for melasma? And if lasers, which ones?
That's a very good question. Lasers and peels both have their place for melasma treatment. And I'll break down the pros and cons very simply. Chemical peel can be effective for melasma treatment and is considered to have a high safety level, especially when they're used lightly for melasma. Okay, and that's really the strength of a chemical peel for melasma. On the other hand, laser can potentially be more effective in fewer treatments and have a more dramatic sort of benefit. But the flip side is that laser can be more dangerous than chemical peel for melasma. Melasma itself is a very tricky condition to treat with both laser and peel. And so caution has to be used in both scenarios. But it really comes down to the skill and experience of your provider. And so if he or she is comfortable with peels, then go with the peel. If he or she is comfortable with laser, then go with the laser. But if you want the fastest possible result, then laser tends to be the way to go.
Okay, great. Let's see. This is from an anonymous person. Hi there. My concern with all these lasers is you don't know how many times you will need them to get rid of brown spots, and so the cost can vary dramatically without knowing up front. Do you quote to remove the spots despite the number of times you laser, or is it per visit? It seems the per visit model is favored just towards the practice because we have to keep coming back. Do you ever consider quoting for price to get rid of the spots?
Yeah, that's a very good question. I struggle with that practical problem every single day because brown spot treatment makes up a huge portion of my practice. Um, and so essentially it depends. There are some brown spots that I know will respond extremely well. And I can almost guarantee that they will be significantly improved, if not completely gone, within 1 to 3 treatments. Um, and if I, with my experience, am able to sort of identify those spots, and that's the problem, then I can communicate that to my patient, okay, with a fair degree of certainty. And if, on the cases that I'm wrong, which of course does happen, then I often just throw in treatments, maybe another one or two, and that's honestly all it would take to really get satisfaction, okay? There are some brown spots that just will not be completely removed, no matter what you do. And some brown spots that will take more than 3 treatments to get much better improvement. And these are the spots that I really have to be upfront with my patients and tell them, well, this is the expectation. Okay, and so that's kind of the way to approach it. In a way, I'm trying to combine both models of per treatment cost, but also giving an expectation to my patients so that they can understand that, well, hopefully by this number of treatments, you'll have a satisfactory result. And the different lasers also have different ability to treat quickly or slowly, and some require less treatments and some require more.
Okay, great. All right. Another good question. So, can you use more than one laser in the same visit? And if so, do you charge more to use multiple lasers at the same time?
So the answer is emphatically yes. And that's why in my webinar, I kept on mentioning sort of combination laser treatments. This is something that our practice and many of the senior members of our practice have pioneered over the last many decades. One of our sort of senior associates, who unfortunately has since passed away, his name is Dr. Richard Fitzpatrick. Him and Dr. Goldman were one of the very first ones actually to combine multiple different laser treatments into a single treatment session, and all of them being, pretty aggressive treatments actually. And we're able to demonstrate a very high level of safety and a very high level of effectiveness when the techniques were done properly. And so combination laser treatment is a major specialty of our clinic. And the reason why we do it is because when we combine lasers, it is more effective than any one laser alone. And that, in the long run, actually reduces the number of treatment sessions that are required and reduces the ultimate cost. That being said, per treatment, if we're using many lasers, then there may be additional costs to the different lasers that are used. But again, usually when we combine lasers, each laser is kind of, we can knock down the price a little bit on some of them in order to just make it a more efficient treatment and give better value.
Great. Okay, thank you. So here is one, another anonymous. He says, for a white man with a dark beard, do these lasers remove hair on the face if it's unwanted?
So yes, some lasers can definitely remove hair on the face, especially dark hair. And of the lasers that I've kind of mentioned in this webinar, IPL is one that can do so. The peak away cannot. The V-beam tends to not be able to do so. And then there are specific laser hair removal lasers like the Alexandrite laser, some diode lasers, Nd:YAG laser, et cetera. These ones are specifically designed to remove hair. So the short answer is that yes, some lasers can definitely remove hair. And if that's a wanted scenario, then that's great, because then we will select lasers that will have that added ability. But if it's an unwanted scenario, then we have to be made aware of that and therefore select lasers that will not remove the hair.
That's great. And so if a man has a beard, would he shave before you do the treatment, or you just treat around the beard?
So yes, if you want to treat that area, then some lasers will require shaving. Some lasers can actually just go straight over the beard as long as it's not too much. But some lasers will require shaving prior to treatment. That being said, if wearing a beard is the normal habit, then many of my patients elect to not treat the area under the beard and just treat around it. And that's totally fine too.
Okay, great. All right. So Virginia says, thank you. And do the treatments hurt?
Ah. So the whole purpose of lunchtime laser is to try and minimize pain and discomfort and minimize downtime. Um, so that being said, any laser treatment that is effective will probably have some degree of discomfort associated with it. In my practice, I hate pain and discomfort, and I take great measures and lengths to try and minimize discomfort at all possible sort of junctures and in all possible ways. The lasers that I've described in this webinar, often I find just topical numbing will suffice to make them reasonably tolerable. Um, and that reasonably tolerable means anywhere from like a 0 or a 1 out of 10 pain, so literally you don't even feel them, up to maybe like a 5 or a 6, so it's like moderately uncomfortable, but still tolerable. And so pain definitely is a consideration that I take into account very seriously. And it's something that lunchtime lasers have sort of the advantage over other more aggressive lasers because they tend to be less painful.
Okay, let's see. One person has a good question. They said, I didn't think IPL was a laser. So maybe you could explain a little bit how those work.
Yeah, that's technically very true. IPL is not a laser. IPL, intense pulse light, it's actually a light. It's a broadband light. What that means is that lasers emit wavelength at just one single wavelength. So for example, the V-beam laser, for example, emits at 595 nanometers, okay? Now, IPL being a broadband light, what that means is that it emits light energy at multiple different wavelengths all at the same time. Okay, and so it's not actually a laser. I lump it into lasers just for the sake of simplicity because it is a light-based treatment that acts along similar principles and mechanisms of actions of laser.
Thank you. Okay, so a lot of you are coming in anonymously, which is perfectly fine, but here's another anonymous one. Hi, Dr. Wu. What are your thoughts on the efficacy and safety of long pulsed alexandrite versus picosecond lasers for pigmented lesions in patients with skin of color?
Ooh. That's a good one.
Long pulsed alexandrite versus pico way for
The
pigmented.
debate, yeah, the debate for skin of color and pigmented lesions is always long pulse laser versus short pulse laser. And in the past, and there have been studies to show this, it has been thought that long pulse laser, like a long pulse alexandrite, for example, is safer than short pulse laser in skin of color. And by short pulse laser, we mean Q-switched or nanosecond lasers, okay? And this is literature dating back 10, 15 years. However, with the development of picosecond laser, the pulse duration is even shorter than nanosecond or Q-switch. And that we find actually makes the treatment even more effective and safer than the Q-switch laser. And so in my experience, the picosecond laser is just as safe, sometimes even safer than the long pulse laser, but it's more effective. The Q-switch laser was always more effective than the long pulse laser. You could achieve much faster resolution of pigmented lesion, like 1 or 2 treatments and they're gone. With a long pulse laser, it would take like 3 to 5 treatments, sometimes more. But with picosecond laser, you kind of combine the best of both worlds. You get that safety that you had with the long pulse laser, but you get the speed of resolution and the effectiveness that you get with the Q-switch laser. And so I find in my practice, I use the picosecond laser every single day, and it's one of my major specialties. And a large percentage of my patient population is, in fact, ethnic skin tones. And I've found it to be really quite a good option. It's not perfect, of course, nothing is perfect, but it's really quite a good option in this situation. So I would personally choose the picosecond laser over the long pulse alexandrite for most cases of benign pigmentation in skin of color.
Okay. Let's see. Do you find that the radio frequency microneedling is safer for skin of color compared to lasers?
So that's a little bit harder question to answer because, again, the blanket sort of statement is that every device can have a very high safety profile if it's used in the right situation and in the right way. And that being said, the theoretical advantages of RF microneedling in skin of color and why I use it very frequently in skin of color as opposed to traditional fractionated laser is because the needles are cold. And so they don't damage the skin as much as the hot laser beam. And therefore, it theoretically has a much lower risk of inducing damage that will cause unwanted inflammatory pigmentation, what we call PIH, or post-inflammatory hyperpigmentation after the treatment. And this has been shown in a variety of studies as well. But I have to stress really that there are great fractionated lasers out there. I use most of them, and they, when used correctly, are also very, very safe. So again, it's the right situation at the right time in the right way. But theoretically, RF microneedling can be a little bit safer and have a little bit less downtime than some traditional fractionated lasers.
Okay, great. Let's see. This is from Yuri. Are there any laser treatments to help with eye bags with minimum downtime?
The short answer to that is probably not. So I published a paper 2 years ago or so in our national laser journal called Lasers in Surgery and Medicine, looking at the treatment of under eye area with a couple of different picosecond lasers. And honestly, they weren't really that effective. They helped the under eye area when there was a significant amount of pigment there, but when it was not pigmentation induced, if it was like hollowing or eye bags or vasculature or whatever, then the lasers weren't really that effective. And so if it's truly a bag though, if it's like a fat pocket that is bulging out, then those can actually be targeted with a surgical sort of technique called laser blepharoplasty. In some cases, can really reduce the eye bag appearance. But most eye bags are not due to actual fat pockets. They're more due to volume loss and a combination of pigmentation and hypervascularity, as well as skin texture changes. So it's a bit of a complicated area to treat. At the end of the day, a multimodal kind of approach, including laser and injectable and potentially surgical options, are the way to approach that kind of problem.
Okay, great. Hillary said this a few minutes ago, so I don't know which answer she was referring to, but she said, excellent answer. This makes me really like and trust Dr. Wu. So thank you so much for that. Thank you, guys. This feedback is so helpful, and it's nice in real time because Dr. Wu cannot see you. So please, any feedback, keep it coming. Okay, let's see, from Linda. Dr. Wu, can you estimate the number of treatments for a keloid scar that's 0.5 centimeters? Can you offer to suppress the scar that's raised in color? Can you offer to suppress the scar that's raised if color is not my goal on the scar?
Got it. Okay, so my understanding of the question, Linda, thank you, is that it's a reasonably small scar. The 0.5 centimeters, is that how thick it is or how long it is? But either way, let's just say it's the thickness is really what makes the difference. And it's also not a scar that you're worried about in terms of discoloration. You just want it to be flatter. And so the answer to this question is, it's variable, unfortunately. And I hate that answer, and everyone hates that answer, honestly, because I like to be more precise. But the range that I tend to see for that specific type of situation with the perfect treatment and average response to perfect treatment would be somewhere in the range of 5 to 10 treatment sessions. 10 being quite a lot, but honestly, sometimes hypertrophic scars, true keloid scars, are extremely resistant to treatment. And so that's a little bit of a downside to embarking on that journey. But it's important to have very realistic expectations about scar treatment. That being said, I've seen scars respond in like 1 to 3 treatments, and that has happened before. But I would say on average, 5 to 10 is more close to reality.
Okay. And then she also says, does V-beam cause a bruise on Asian ethnicity skin?
V-beam can bruise any skin. If you enter certain parameters into the device, it will almost certainly bruise the skin in anybody. And for a select few conditions, we actually have to bruise the skin to get the best result. But for most conditions, we try not to bruise the skin, actually, because it's unsightly. And we can still achieve very, very good effectiveness without bruising the skin. But the answer is yes, V-beam can bruise pretty much any skin type.
Okay. Aria says, thank you for the lecture, Dr. Wu.
Oh, thanks, Aria.
Okay, so here's another one. What is the best laser to tighten skin?
Yeah, skin tightening is not something, unfortunately, that we're really fantastic at, in my opinion, yet. There are specific skin tightening devices, okay, which rely on things like focused ultrasound, radio frequency devices that essentially treat the deeper layers of the skin. And that is what is thought to really improve the tightness of the skin, okay? But those are not lasers. In terms of lasers, the greatest tightening effect that we will see is with the strongest lasers, okay? And these include the CO2 lasers and the erbium YAG lasers, what we call the ablative lasers. And using them in what we call fully ablative mode, as opposed to fractionated ablative mode, is actually the way to get the most tightening. And again, this has been shown in studies dating back decades that have demonstrated this principle. The problem is that not everybody can undergo the ablative treatment, and it's not appropriate in every skin type. But if you want just absolute, the best tightening method for laser, that is actually the best way to tighten skin with laser.
Okay, all right. Here's another great question. I wonder if some of you are doctors in this group. Some of these questions are so good. Okay, I had 3 BBLs on my arms and chest to get rid of sunspots with no success. What is the better option? I think you are going to say peek away, haha. But there are so many studies from Stanford saying that BBLs change gene expression and are touted as the best. What do you think?
Yeah, so BBL, otherwise known as broadband light, is another name for intense pulse light, or IPL. And how these lasers, well, laser quote unquote is light, as I mentioned previously, but how these devices work is they're considered long pulse devices that target the melanin or the pigmentation in these brown spots and basically make them heat up and then disappear because the body recognizes them as injured. The problem with BBL and IPL, et cetera, is that for discrete pigmented lesions like sunspots or seborrheic keratoses or anything that is actually a discrete proliferation of cells underneath the skin, the IPL or the BBL sometimes has limited effectiveness in those situations because it doesn't actually remove the cell itself. It just targets the pigment that is there, and the pigment goes away temporarily, potentially, but the cell will produce that pigment again, and it will come right back. And so I'm not surprised that, chest and arms especially, you unfortunately not having the response that you wanted. And so if it's discrete spots that are bothering you on your chest and arm, then there are a variety of effective treatment modalities. And the peek away is, my go-to laser. It works extremely well in almost all skin types for this problem, both on the chest and arms and legs and body, etc. But barring that, there are other lasers as well. I mean, the Pico Sure can do it. The Pico 4 can do it. All those picosecond lasers can basically do it. The Q-switch lasers can do it. So Q-switch ND YAG, what we call the Q-switch frequency doubled ND YAG, the Q-switch Alexandrite can do it, the Q-switch Ruby can do it. And even the long pulse lasers like IPL and pulse dye laser or V-beam laser, so-called, there's one laser called the XLV, which is a frequency doubled NDA, that's long pulse. These can all do it as well, but they have to be used in a special way, not just scanning over the skin, but actually multiple pulsing on that specific spot to achieve a very specific kind of clinical endpoint that will tell us that the spot is probably going to resolve. And so the short answer is the short pulse laser is probably going to be the more effective option for you. That being said, I haven't really seen your arms or chest, so that would, of course, determine more specifically what the way to go is. But the BBL and IPL is more better for kind of diffuse discoloration rather than specific spots.
Great. Okay. All right, guys. We have time for a few more, and they are coming in fast. So Marcus says, Dr. Wu, I just wanted to say a huge thank you for taking the time to host the session and explaining the science behind some of the lasers. Hope everyone's doing safe and well. Linda says, you are a delight and joy to listen to. Thank you for your expertise. Just want to make Dr. Wu blush for a second. And then one more, Teresa says, I just want to mention I had an in-office consultation with Dr. Wu a few weeks before everything shut down. I'm looking forward to your office reopening so I can schedule my procedures. This webinar has me motivated.
Oh, thanks, Teresa. Hope to see you guys soon.
Okay, I'm really happy you guys are finding a lot of, a lot of help from this webinar. That is our goal. Okay, so here's from Jessica. I have 3 small flesh-colored bumps in my butterfly zone. I'm not sure what they are, but I want them gone. Is there any kind of laser that might be able to help?
Yeah, skin color bumps are sometimes the hardest ones to treat with laser actually, because laser relies on the principle of seeing some sort of color and targeting those colored molecules and therefore having its effect. That being said, like I mentioned, there are lasers that target water. And water is in almost every single tissue and part of the skin. And so some skin colored bumps can be targeted by those lasers that target water and removed effectively. But there are a lot of different types of skin colored bumps, and they range from, just benign moles to, enlarged oil glands, sometimes fibromas, and other types of hair follicle uh, bumps and stuff like that. And so it really depends on the type of skin colored bump in order to determine whether or not it can be treated effectively with laser.
Okay, great. Here's one. If I don't live near San Diego, how can I find a dermatologist near me that's qualified to perform these laser treatments? What should I look for when researching?
I get asked this question once in a while in terms of what you should really look for when you go to a cosmetic physician. Um, and everybody has a little bit of a different opinion. Um, but I think some things are standard and should be true. The first is, their qualifications and their training. So, what kind of training and qualifications do they actually have? Are they a specialty trained physician with years of experience or additional training in these types of procedures, or are they just kind of doing this on the side or that kind of stuff? So that's very important to, and that's easily, you can see that online and read reviews to find that kind of stuff out. The second thing that I like to sort of recommend is that whenever you're considering a procedure, ask your potential provider, how many has he or she done? What kind of results has he or she seen? And does he or she have any kind of, before and after pictures to show of their own work and to give a more realistic sort of impression? Um, those are kind of like the two major things. Most cosmetic physicians will offer, a consultation that is either minimal charge or free. And during that consultation, it's also important to really find out, how comfortable you are with them. And also extremely important how comfortable you are with their staff, because it's their staff that will be also very involved in your care, and the best practices will have very good teams in place that will take care of you. Those are kind of my general pieces of advice. I know it's kind of hard to find a good laser physician sometimes because there's just so much out there and you don't really know what to trust.
Okay, great. All right. Let's see. Um, so I think here's one more good question. If you combine lasers with injectables, which do you do first and why? And are there any injectables you commonly combine with lasers for skin tightening, facial contouring?
Yes. Okay. So this is actually quite a complicated question, and it's one that I teach my fellows every single day, because there's no one right answer to this question. It depends on each clinical situation and exactly what I'm trying to achieve. And so I'll split it down into like the filler component and the laser component. The filler component is determined by the placement, the location, and the depth that I'm intending to inject the filler. Okay. Um, Deep fillers can be placed either after or before laser, and because they're so deep in the skin that multiple studies have shown that they're not really going to be any effect if you laser over the filler. Okay, but superficial fillers you need to be much more cautious with, because sometimes the laser can actually reach those types of fillers and maybe have unpredictable or unwanted effects. And so superficial fillers may be more appropriate to deliver after a laser treatment. Again, the laser itself makes a big difference too, because if you're doing a very light laser treatment, then those have been shown to be actually fine over multiple different types of fillers at multiple different kind of depths. However, if you're doing a very strong filler, or beg your pardon, a very strong laser, then you might have to be more cautious with the order in which you do things. And so at the end of the day, what I try to teach my fellows is you have to have a rational approach that takes into account your patient's needs and desires, as well as your sort of toolbox, the skills that you have and the products and devices that you're working with. And you have to have a lot of knowledge about those products and devices in order to basically design the right plan for them. Skin
Okay.
tightening and combination of skin tightening and fillers. So the fillers, short answer is for skin tightening, you want to kind of, at least our current thinking is that you want to sort of produce more collagen. And so it's the so-called biostimulatory fillers that I like to use for skin tightening purposes in combination with skin tightening treatments. So these would be like Sculptra or, Radiesse, but almost all fillers actually have some stimulation of collagen effect to them.
Okay, great. All right. One more good question from a Dennis. So he says, hi, Dr. Wu. Is treating severe acne scars one of your specialties? Have you ever treated patients with ablative lasers under sedation?
Yes. So treating acne scars is actually a major specialty of mine. I do it a lot, and it's probably one of the majority things that I see in my practice. Um, and so the answer to that is yes. And a lot of different types of treatment modalities for lasers and for acne scars, and lunchtime lasers can do it, but are sometimes a little bit too weak, and that's where ablative laser comes in. And I do a lot of ablative laser resurfacing for acne scars and for general rejuvenation. In fact, like I mentioned, two of my mentors, Dr. Richard Fitzpatrick and Dr. Goldman, were the pioneers of ablative laser treatment. And they were proponents of extremely aggressive laser treatment, if done correctly, can be very, very safe. And so sometimes I find that acne scars, you just have to have, or you have to use the stronger laser in order to achieve a satisfactory result. Resurfacing lasers, like I mentioned, my good friend and colleague, Dr. Billy Groff, who also was one of my fellowship trainers, he did a really great webinar on this type of thing last week. But yeah, it is one of our major specialties. Ablative laser is not as common these days, but we do a lot of it still because it still definitely has its place.
Okay, great. All right, everyone. A lot more messages are coming in. Thanking you so much. So I think a lot of you are getting a lot of good use out of this time. So I'm really happy about that. Dennis also asked if you're going to do a webinar just focused on acne scars, and I'm glad he brings that up because we are just starting this webinar series. This is new for us, but we've definitely had a lot of great feedback that that we think a lot of you are finding it very useful. So we would like to definitely continue providing this, especially during the stay home mandate, but even beyond that. And so any ideas you guys have for topics would be great. I will definitely write down one on acne scars right now because I agree that would be great for Dr. Wu to do. It is definitely a big area of his expertise. So anyways, it is past 1 o'clock, so I think we should wrap this up, but I just want to end by thanking you all for coming and spending some time with us. Thank of course, Dr. Wu for being so honest and articulate. Linda, you said it perfectly in your quote here. And, for all of you, if you would like, one-on-one information for Dr. Wu to actually see pictures of you and video chat with you, he is available for virtual consultations. You can go to our website, which is up on the slide right now, and schedule something. You can see Dr. Wu's schedule. You're also welcome to follow him on Instagram and send him questions or email us. And then next week, we do have a couple more webinars coming up. We're actually going to change the format a little bit because it seems that you all like the presentation format with Q&A at the end instead of just open Q&A. So next week, we're going to modify it a little bit and just do the 2 presentations. So on Tuesday, it's going to be Dr. Mitchell Goldman speaking all about leg veins and giving a presentation with time for Q&A. And then on Thursday is Dr. Monica Bowen, who's going to be giving a presentation all about wrinkle smoothing and lip plumping, so basically injectables. And that is on Thursday at 12 p.m. So those will be our 2 webinars for next week. Please make sure you're following us on social media to keep in the loop, and you'll get the text message reminders as well. Otherwise, we really appreciate your time. We hope for those of you that were our patients, we will see you back in the office soon. For those of you that are not, maybe we'll see you one-on-one for a video consult. And after this closes, you're going to get a little survey that comes up. We appreciate any other feedback you might have. And overall, any last words, Dr. Wu?
No, I just want to thank everyone for watching. It was great, and hope you guys all stay safe, and hopefully see you guys all soon.
Okay, great. So thank you guys so much. Happy Friday, wherever you are in the world. And we hope to talk to you again soon. Bye, guys.